So then now we're getting farther down the ilium and getting more deeper, and now here's where the gluteus minimus is going to come off of. So it's going to be on the lateral part of the ilium below the gluteus medius. So we talked about the three different gluteal muscles. The maximus is going to be more towards the medial side, and it's going to be higher on the ischium, or ilium. Then the medius is going to be down here, and then the minimus is going to be even farther down. And then again, that's going to insert onto the greater trochanter of the femur here. So again, it's going to do abduction and medial rotation. So the medius and the minimus are going to do medial rotation, whereas the maximus is going to do lateral rotation. And then if we talk about muscles that are crossing the knee, on the posterior part, actions are going to do knee flexion. So those are going to be the hamstrings. And then we won't really be covering it now. The gastrocnemius, it also does knee flexion because it's crossing the knee. So that's going to be this muscle here, which is basically your calf muscle. So now we'll get into the hamstrings. We have the biceps femoris, and again, this is going to have two heads. So one's going to be from the ischial tuberosity, and then it also is going to come off of some of the bones of some of the parts of the femur here too. So there's again that linea aspera, and then here, this is the short head, and that's going to come off of the femur, which is going to be the distal femur. And then basically that's going to go to the lateral tibial condyle and then also to the fibula. So that's there's going to be the short head right here, and then this is the long head. The long head's coming off of the ischial tuberosity. And then they're both going into the lateral part of the tibia and then also into the fibula. Okay. And then those are going to be tendons that are going to be pretty easy to palpate, right? So if you palpate on the back here, you're going on the back, you're feeling your knee like this, you can feel that big tendon right there. That's going to be biceps femoris, right? And then you go on the medial side, you're going to have two tendons on that side. One's going to be tendinosus, one's going to be membranosus. Okay, so then the action, of course, is going to be flexion of the knee. But when the knee is in this position here, which way is it going to rotate the tibia? If I contract this muscle here, if I'm pulling this back like that, it's going to externally rotate. But it can only do it when the knee's bent, not when the knee's straight. Okay, so if I'm pulling on the knee here, if I'm pulling this way, I'm doing external rotation. And if you have the tendinosus and membranosus, that's going to do medial rotation. But only when the knee's bent. So then you have the two on the medial side, which is one of them is going to be semitendinosus. And that's the one that's going to be part of that pes run again. So it's coming here down at the bottom, semitendinosus. And then it's going to do extension of the thigh and then flexion of the knee. And then also, like I said, when the knee is bent, it's going to do medial rotation. And then membranosus, again, is going to come from the ischial tuberosity. And then that's going to go on to the medial condyle of the tibia. So it's a little more posterior around the backside of the tibia as opposed to the tendinosus, which is going to be more into that pes rind area over here. So again, it's going to have the same action in the thigh, the hip, flex the knee, and then also medial rotation. So then that leaves us with the one last group, which is going to be external rotators of the hip. And those are all going to be deep inside this gluteal area. Okay? And then here's that's basically the first of all the different muscles that we're going to go through. So working our way from the top down, we have the piriformis here. The piriformis means pear-shaped. Okay? So it's a wider at the insertion, and then at the origin, and then it narrows at the insertion. So that's going to be this one here. Okay? And then that can be clinically significant because you talk about people have, you heard of piriformis syndrome, right? Piriformis syndrome can just be contraction or tightness of the piriformis muscle, but it can also irritate the sciatic nerve, which is going to, people a lot of times will talk about sciatica, right? Sciatica, all that means is just pain going down the back of the leg. Okay, it's not really a diagnosis, it's more of a symptom. You know, it's like just saying, well, my car won't start. That's the symptom. But what can be the cause? Cause can be you have an electrical problem, you can have a fuel problem, you have a lot of different things. You can have sciatica, which is pain down the leg, but there can be a lot of different causes for it, right? You can have a disc problem in the low back, you can have a piriformis problem that's irritating the nerve in the buttocks. So different places where the nerve can be irritated to produce sciatica. In some cases, there is some anatomical variations where sometimes the sciatic nerve will sort of come out right through the middle of the piriformis muscle. Usually it comes out underneath, but in some cases it will actually go through the piriformis, and then obviously contraction of the piriformis muscle can be more likely to irritate the muscle if it comes right through the middle of it. So then the origin of the piriformis is going to be the anterolateral part of the sacrum. It's going to be here. So it starts out anterior to the spine, and then when it inserts, it's coming out backside. So it's going through this greater sciatic notch. So it's starting out anteriorly here, and then it comes out posteriorly. Okay. So then that's going to go into the greater trochanter. You can see right here. So it's coming out from the anterior part of the sacrum, coming through the sciatic notch, and then into the greater trochanter. Most of these external rotators, these deep external rotators of the hip, are all pretty much going to insert in the same place. Generally the greater trochanter, but it starts coming down as we get farther down here. There's a little bit of variation. So the action is going to be to laterally rotate the hip. So all these are pulling on the greater trochanter here, and they're externally or laterally rotating the hip. So then you have the two gemellus, gemellus meaning twins, so you have superior and inferior. So the superior one is going to come off of the ischial spine, and the ischial is going to be the ischial tuberosity. So one of them is going to come up a little bit higher here on the ischial spine, and then the ones on the ischial tuberosity. They're going to be going over like this. Then there's another muscle that's in between them. We'll talk about that. So again, insertion is going to be the greater trochanter of the femur, but each one of these that inserts on the greater trochanter, subsequently they're going to be farther down. So the piriformis is going to be up higher, then the two gemellus is going to be into here. And then it's the same action. They're going to externally rotate and then also stabilize the hip and pelvis.